Hey everyone, welcome back to another episode of the Grow RDH podcast. My name is Katie and I'm your host. And today we're going to be continuing the discussion we started 2 weeks ago. We talked about what patients want and expect in 2024. So if you haven't heard that episode, go back and listen to it. And it was talking about trends. And a lot of the trends have to do with technology and really like teledentistry or online scheduling, online tracking. And so today I thought it was sort of important to start with teledentistry, especially because in our state, in South Dakota, we are sort of in a bit of a shift where the South Dakota Dental Association is trying to get written into the rules for dental assisting supragingival scaling. And that's why I didn't put on an episode last Friday, because I'm on the SCDHA board and we had this really big public informational meeting about it. And everything really cycles together is what I'm noticing. And one of the things we discussed at this town hall was teledentistry. And I thought it was fitting it just got my mind sort of turning, because they talked about teledentistry as a answer to access to care, and some of the dentists on the call really sort of balked at that and said that teledentistry is great in theory but hard in practice. And where I totally agree in some aspects, right? It's hard to treat dental decay or caries virtually. You can't, right? You have to have in-person training and in-person care and all of that stuff. But what I think is important is to talk about teledentistry and the success stories. So what I did was I found 3 programs that teledentistry has been successfully implemented and used. And all 3 of them sort of have a theme where they were really started in COVID. But it was important to me was to find programs that continued after COVID and programs that are still, successful. So what I did was I found these 3 programs, and I just want to highlight each one of them today. And if you have experience in any of those programs, please reach out. I would love to hear your experiences, and I'd love to hear some success stories of how this has worked well. I'd also love to hear the struggles with it. So if you know anybody, tag them. If you have experience with teledentistry and it's successful, I would love to highlight your story and really talk about what makes it work well. So the first one I'm going to talk about is the virtual dental home, and this was done by the University of the Pacific. This was initiated in 2010, but it expanded greatly during the COVID-19 pandemic. For funding, so for each program, I tried to get some really good details about how this was done. And so again, this is just what I could find online. So hopefully this is accurate. But for funding here, the virtual dental home was initially funded by grants. But it eventually was incorporated into state Medicaid programs and to private insurers. So I thought that was really important and really neat. I think for sustainability purposes, being recognized by private insurers is super important. In terms of patient satisfaction, high satisfaction reported due to convenient access and reduced need for travel. In terms of patient outcomes, they saw significant reduction in untreated dental disease. They also saw improved oral health, especially in children and the elderly populations. They involved a number of different dental personnel. The first, obviously, is dentists. They had dentists. They also had dental hygiene advanced practitioners. They had dental hygienists, and then they had dental assistants with expanded functions. So they had a wide range of dental providers. And I think following the trends here is that is the key, is to have a varying amount of different levels of providers that are able to provide different types of care. For the telehealth part of it, they use telehealth for diagnostic records, preventive procedures, interim therapeutic restorations, and oral health education. So that's mainly what they focused on in terms of providing care. And then after COVID-19, this program was continued. So it was part of the curriculum at the University of Pacific. And so it stayed a part of the curriculum and patient care, and it has greatly reduced healthcare disparities in their area. So that was the first one. That again is the virtual dental home by the University of the Pacific. So if you're interested in learning more about that, I'm going to link the program down below so you can check it out for yourself. The second program that I found is called the North Carolina Public Health Teledentistry Program. This also was launched as a pilot program in the early 2010s, similar to the virtual dental home. And this also expanded. But for reimbursement, the program was funded by the state health department and the Medicaid program. This program also, similar to the last one, this program also had private insurance reimbursements, which again, for sustainability, I think is really important. Patient satisfaction. There was positive feedback on convenience and accessibility. And for patient outcomes, there was an increased access to preventive care and reduced emergency dental visits. I like that point, and I think that's a huge deal in terms of if we're trying to expand access to care and reduce need. I think reducing emergency dental visits is huge. And for dental personnel involved, this one had dentists and dental hygienists both. So they didn't have any expanded functions type personnel, at least not that I could find. Maybe they do. If I'm wrong, correct me. But for this, there was dentists and dental hygienists. Telehealth utilization included remote consultations, preventive care, and follow-ups. And again, going back to reducing the amount of emergent visits, I think having remote consultations, I talked about that in the last episode, but the ability to just talk to a provider, I think really reduces a patient's anxiety and fear, and having the ability to talk to somebody and sort of get some answers or get some helps or tips or tricks just to get them, past the emergency stage, maybe get them out of pain. That would be huge. So for use after COVID, in North Carolina, they continued to use in order to maintain access in rural and underserved areas. And it was integrated into regular public health practices, which again is awesome and huge. And I know in South Dakota that there are public health, specifically I'm thinking of Horizons, but there are public health entities that do try and use teledentistry to the best of their ability. There's just some roadblocks in legislation and maybe some regulation issues where they're trying to really get it more recognized as a normal thing or routine, right? But it's just hard. Change is hard and change takes time. So that's why I think highlighting programs like these really do make a difference. The third program I found was the University of Rochester Eastman Institute for Oral Health. This program was implemented during COVID-19 in 2020, but it continues today, and they use teledentistry for consultations and follow-ups. The reimbursement, they are supported by Medicaid and private insurance reimbursements. So I see that as a trend, right? All three of these programs that have successfully been continued all allow for private insurance reimbursement. For patient satisfaction, there's high satisfaction due to continuity of care during the pandemic. And for patient outcomes, they noticed that the current standard or health standards that they were setting with their patients prior to COVID, they were able to maintain that. So their patients were satisfied. They had good oral health outcomes. And during the pandemic, they were able to maintain that level. So that's awesome. There was a positive impact on preventive care and reduced in-person visits. Again, just like we talked about with the consultations, that would make a pretty big difference in just being able to talk to a provider. The dental personnel involved included dentists and dental hygienists. And for telehealth, they employed remote consultations, triage, follow-ups, and post-op care using HIPAA compliant platforms. And it doesn't mean that the other ones didn't. I just couldn't find anything specific to that. But this one was, referenced that they specifically used HIPAA compliant. Again, I'm sure the other ones do too. There was just nothing that I could find. But what I liked that it talked about triage and it talked about post-op, right? And that again would be another really cool way to utilize teledentistry is having post-op follow-ups. You maybe had a tooth pulled and they do a follow-up that next day, but it's over telehealth and you can just call your doctor and explain, your concerns or ask a question, describe the sensations you're feeling. And that would just be huge for making patients feel like they have access to you as a provider. So after COVID-19, this program sustained as a part of standard care practices to enhance patient management and accessibility. So there you have it. 3 successful programs, all using teledentistry that were expanded or implemented during the COVID-19 pandemic and continue today because of the use and patient satisfaction that comes from having the ability to talk to your provider one-on-one or having more of a direct line of communication that they can use. And I think that all this does for us is it gives us hope and it gives us ideas about what we could potentially implement in our offices to sort of do 2 things, right? One, we're meeting the patient's expectations of what healthcare delivery can do now in this post-pandemic era. And 2, it opens up communication between them and allows us to make that connection and make that communication easier, right? We don't have to call. It's like the phone a nurse. For the pediatric unit, when you're a new mom and you just have questions, there's a nurse on call in the pediatric unit. And so I just think that it's super exciting and I would love to hear your stories. So I really want some feedback on this episode. I would love to hear some of the smaller programs that maybe we don't even know about. Maybe there's no media around them, but you know of a really cool teledentistry utilization in your area or in your office or somebody does it really well. I would love to highlight some stories and talk to some people that have done this successfully because the more we hear about what works, the more likely people are able to utilize it in their own offices. So thank you for joining me. This is going to be a short one today, but we've had a lot on our plate with all of the coronal scaling, supergingival scaling stuff going on. We've had a lot of good feedback from our state, and I think we're making a lot of good progress in trying to really advocate for dental hygiene professionals. But yeah, it's been interesting. So I appreciate you guys listening. Please like and subscribe. Please share with a fellow hygienist that you think might like this content. And I will see you next Friday. Have a good week.